Hey everybody, it's Matt and Dyan. Welcome back to OK Aussie. Get your favourite sensory toys prepared. This is a conversation about the autism, that one, you know, the autism side of things, which Dyan and I both have, but from different perspectives, male and or female. Dyan is very much classic autism and comes from a background of having a genetic chromosomal condition 22q11.2 deletion syndrome, which forms the basis for that. In fact, patients with that genetic chromosomal disorder, actually 20 to 30% of them will have autism. 40 to 60% will have ADHD. Now, both of us are autistic, ADHD and OCD on the spectrum, and we have a channel where we have conversations about that. And
autism.
As a carer, as a patient with a person with disability, as a family, how we manage and navigate through those sort of conditions.
Yes.
And today's conversation is going to be a little bit of an interesting one because
jewelry.
You've got that, I've got this. We've got a cat down here as well. There's a cat.
That's a fidget.
Yeah. That's a fidget and a half, that
I
one.
Cuddle and
it's a
kiss
sensory
him and treat him like a baby.
Sensory sensations.
He likes it, okay?
Now, you were late
my baby.
Diagnosed with autism.
Yes.
As far as going through the clinic psychology approach of getting, you know, the whole DSM, the Diagnostic Statistical Manual, and getting all of that. Later in life, again, 48 years of age, you got a genetic diagnosis, which supports that as well. As I just mentioned, there are so many people who have that genetic condition that will be somewhere on the spectrum between the ADHD and autism. And as we've seen, obviously, from people like Professor Dr. Tony Atwood, who is an Australian clinical psychologist who specialises in female autism.
Handy,
as we've seen the crossover, it's
Atwood with double T.
You're likely to have ADHD anyway as part of the mix and the blend. So there's some interesting things in that. Now, the research has always been male orientated in the area of autism, particularly when you go back to the
psychology.
Yes, and I was going to mention that.
Even medical science is mainly done on males. Let's not forget that.
No. But it was interesting that you said that too, because so many females, particularly because they're so great at masking, slip underneath the radar.
50% of the autism.
And so many female autistics also go into the sciences like psychology to learn more about themselves and people and how everything clicks.
Until I'd done it. And then Tony Atwood said most of them go into psychology, and I was like,
Now, we've learned a lot.
I didn't do that.
We've learned a lot along the way, and I'm going to say a couple of little catalysts to this before I get into this. I'm going to talk about a piece from the conversation. It's a news article which I'm going to share. We're going to have a conversation about. Dyan has not seen. She doesn't even know what the topic is. She's just trying to keep up with me. It is 4:48 in the afternoon. You're getting a little bit hot, are we?
I turned the heater on. It was the biggest mistake I made.
First of all, why would you do that?
I felt temporarily cold, I guess, and I thought, I need some.
37.9. So Dyan is febrile. I'm just going to give you a Panadol before we start that conversation.
Sorry, guys. Sensory nightmare getting a temperature. I feel like I'm melting.
Okay, you want me to open the back door to get some fresh air in here? We'll get to this conversation in a moment. Okay, crisis averted, back door is open, fresh air is flooding through, Panadol osteo provided.
Is equal females to males, do you reckon? 50-50?
Yes, I actually do believe that myself.
I do too.
Now, the reason I'm getting to this, and also coming back to that 22q research, if you look at the clinical guidelines for Dyan's genetic condition, it's preparation needed to transition from childhood into adulthood, because suddenly at the barrier of 18, autism and ADHD doesn't just suddenly flitter and disappear away. And we've talked about that many times. But here's an extension on that. And I'm going to read this article because this is perhaps one that we don't think about, because we still consider ourselves very young at mind and heart.
Yeah.
51 years of age chronologically. I'm 55. However, as we've seen with the neuro... Did you just tick down?
Oh, don't tell me that.
With the neuropsychologist, Dyan's cognitive mental sort of age group is around about 18, and she's obviously been extensively tested as part of the process, and we expect that having on the basis of GDD, global developmental delays, and IDD, intellectual developmental delays. But you weren't prepared, I guess, for the transition into adulthood at the cusp of turning 18. In fact, you're probably the worst prepared example we could possibly ever get is a family that actually was ignorant
too soon.
to autism and understanding it, and
Dangerously
literally
too soon.
kicking you out of the home so that they didn't have the
dangerous.
responsibility
It was
of dealing
dangerous.
with autism
It was actually dangerous.
or your health.
Guys,
And it was.
it was dangerous.
But here's the extension and why we're talking
Something
about.
could have happened to me.
We're setting the prelude to this because this conversation is, what do we do and what don't we know
Right.
about autism and aging? And there's some new research about that
So, yeah,
from the
I
conversation.
haven't looked at this.
So I'm going to
Ever.
read this to you, and I know your difficult, most complex strategy is the
I'm
inability
listening.
to not talk, and I know that's
No,
a
I'm
challenge,
listening.
and that's part of Dyan's difficulty with ADHD, the urge and impetus, and sometimes going off on multiple tangents.
Yeah.
So this can sometimes be a bit of a challenge. So please bear with us as we do this. She also hasn't seen this information, so I was just trotting through the news, and I'm always alert for articles and new research, because keeping up with new research I find is actually very important, because it helps you to learn what's going on about yourself, your people that you're caring for and looking after or responsible for, but also for future planning as well, if we have this as a conversation.
Yeah.
Speaking about a conversation, this is from The Conversation. It's a online newspaper. This is written by Gavin Stewart from the King's College in London, and it was published on September 2nd, 2005. So the title of this article is What We Do and Don't Know About Autism and Aging, New Research. And with your condition with 22q, there is no longitudinal studies specifically in it. In fact,
no, we're normally dead.
Anything above 30 years of age, they don't know. They haven't actually gathered the information. And you're right, so many, unfortunately, with your genetic chromosomal condition,
you need to study me
morbidity is actually pre-birth in the first couple of years of life.
Yes.
Or if you're lucky to get to that 40-ish years of age.
And to survive to 3, and then
Sure.
Yeah.
Now, just as much as with 22q as it is with autism, if you've met one person with any of these conditions, you've only met one person. It is a spectrum, and each day can be different. There are different degrees of autism when we talk about the autism spectrum.
Yeah.
Some can have it more so than others. And these days we use more terminology around support needs, how much support needs are required, as opposed to maybe the functioning or capacity, high functional. Yeah. So you can be very high functioning, but you can still require quite intensive support needs.
Mm-hmm.
Okay, so that's a bit of a preface to all this. I want to read some of this article. The picture, first of all, starts with a look at an old gentleman sitting on the couch. We're assuming that he is autistic, and the subtitling underneath this is autistic people experience different challenges as they age compared to their non-autistic peers. So you can see the title, and this is the article that we're actually talking about as a reference, and I will link that in the conversation below. Are you playing with your magnet?
It won't link properly. I've made 2 bracelets.
Right.
And
keep working on that. Okay, let me read through this. Autism is often thought as a childhood condition, but this is far from true. Autism is a lifelong condition. And most autistic people are adults, yet less than 1% of autism research has focused on older autistic people. This means we know very little about the needs of autistic people as they grow older, and whether they face unique health challenges as they age, especially when we're talking about the comorbidities.
Yes.
Now, when we talk about you as a...
comorbidity 22q.
Great. And look, you have multiple health conditions that are commonly seen by people with autism now. 25% of female autistics might be hypermobile, for example, so the hyperflexibility.
Very common.
Another 25% of them might have eating or disordered eating habits. Anorexia is part of that. ARFID, pica, so eating the inappropriate sort of things.
Yeah, no, I never.
Avoidant, restrictive food intake. Or gastrointestinal related issues as well might come part of it as well. Yeah. Look, seizure disorders can also be seen in people with autism. I think it's 1 in 5, so 20% of people. So there's those. Of course, learning disabilities, because it's a neurodevelopmental condition, are very, very atypical in presentation. So, just for that understanding. So this means that we know very little about the needs of autistic people as they grow older and whether they face unique health challenges as they age. So to better understand what the current evidence tells us about autism in midlife and then old age, a colleague and I, and this is obviously Gavin Stewart from King's College in London, a colleague and himself, recently conducted a narrative review of more than 70 published papers from across the globe. And we've done the similar, particularly with your genetic condition, where
Yes.
we have researched the medical journal articles peer reviewed for Dyan's condition and keeping it with cutting edge, which is really important for a genetic condition which is still only just been discovered.
The scientists are still talking about it.
Yeah, look, there's
every day.
7,000 rare conditions, 250 rare conditions are added each and every year. Of those, only 5% of them actually have a plausible in-situation support process in place to actually help those participants. So that's a lot of people that don't have health and management and ongoing care with their healthcare. Now, in Australia, that represents a lot of people who are affected by disability.
It's not just the person, it's their family.
No, and in fact, 3 million Australians are the
genetic,
informal supports and carers for people with disability.
If it's genetic, you pass it to your child, and if they didn't tell you soon enough, like in my case, you affected my children, so 50% pass that rate.
And look, in that sense,
it's pretty big.
We've got a very neurospicy family. One child who is autistic and one child who is ADHD.
Yeah.
So that's actually quite commonly seen, and actually for a lot of females, actually what leads to a diagnosis later in life, because the child gets discovered more so these days in the current era. And then that leads to questions of is mum or dad or both potentially on the spectrum as well. So what does Gavin Stewart from King's College London have to say after reviewing the 70 published papers in this space? So our findings revealed that autistic people are more likely to face poorer health outcomes in midlife and old age compared to their non-autistic peers. Our review found that the core characteristics of autism, such as differences in communication, repetitive behaviours, dedicated interests, hyperfocus, remain relatively stable into later adulthood, although there's some variability in individual experiences. For example, some autistic people find that their senses become more sensitive as they age, while others don't find this to be the case. All right.
I don't know.
For those diagnosed with autism later in life, receiving this diagnosis often proved life-changing, giving them greater self-understanding and acceptance of themselves. Would you say that's the case for yourself? That your late diagnosis actually answered the questions as to who you are, why you're doing what you do, and how you're received by others?
It gave me relief, but because I wasn't diagnosed when it was considered, like there was awareness about it, it was not as easy to relax about it and just
the acceptance
unmask
phase,
because no one actually knew of autism. So if I was to say to someone, oh, I just got diagnosed with autism, the ones that I did tell, they looked at me like,
and what is that?
They just didn't know. They had no idea.
So in the last decade, that
I felt
awareness has obviously dramatically improved.
I felt like I understood myself. I looked at Tony Atwood and went, oh, he's been stalking me, but he hadn't been.
No,
but like,
he's very in tune to female autistics.
I was like, this dude knows everything about autism.
Dr. Tony Atwood has got a lot of YouTube videos. He appears on a lot of conferences. He has a lot of books and
I did
audio books. So there's a lot of content that's out there.
Like I just
you did, absolutely. And I'd like to say,
how would you explain it?
And because we're both autistic, and I think there's a helping process, and particularly in later years, most recent times, I think the growth is also exponential. Not only is it the acceptance, the relieving yourself of the masking, but understanding yourself, whether you're talking about things like gestalt language processing, whether it's talking about hyperintensive episodic memory style, whether it's talking about your learning difficulties with dyslexia, just understanding a lot of those sort of aspects, you've actually come to grips with that and actually learning better strategies now to deal and cope, but also accept where you are, what your baseline is and what never will change.
I'm seeing young ones do it at the same time as me. So it's not all bad. It's just that my generation, sadly, they didn't get me in time, as far as I'm concerned. But I'm so glad seeing people younger than me have a better life.
Absolutely. Now, Gavin Stewart from King's College London goes on to say about more health-related difficulties for those with autism. So health problems are a major concern for autistic people as they get older.
Why?
That worries me already, considering your health concerns are a major issue right here today. We found that autistic people are more likely to experience most physical and mental health conditions than their non-autistic peers. This included greater risk of being diagnosed with cardiovascular disease, don't go there, right? Anxiety and depression, and other age-related conditions such as osteoporosis and Parkinson's disease. Now, ironically, your condition 22q has a direction. No, it actually has, in the neurology side of things, a high precedence of Parkinsonism and Parkinson's specific. Okay, so we are aware of that. Our review from King's College in London, our review also revealed that autistic adults may be more likely to experience more complex health problems. Don't we know for this one? For instance, one study showed autistic people were more likely to be diagnosed with multiple health or mental health conditions. Oh gosh, yes. For those in midlife, menopause is a challenging transition. I would say for you, and this is anecdotally myself as a male looking at you as a female, every day from transition in your teenage years, going through pregnancy, but also then in menopause was worse. Menopause and actual menopause.
Perimenopause at one point, hormones. And menopause, wasn't I bad?
Absolutely, the hormones.
I had a meltdown every single day because my hormones are like. Think of it as you're a normal woman, right? You're going through perimenopause. It's shocking. Menopause, shocking. Think of it as someone goes into that already disabled, already got autism and sensory overload. Right? Yeah. Even a normal person can't handle the dampness of perimenopause and menopause. Yep. I was not coping. No. And I was, of course, sensory overloaded with, you add one more stressor and then another stressor. And
that's it. If your threshold's starting here, it's very easy to tip you over the scale. Yes. And then it becomes too much to manage.
Be prepared for perimenopause and menopause if you are autistic and you're a woman.
Okay.
So I'm so sorry. And if you're a guy, look after your woman who's going through that if they're autistic.
Sensitivity, have understanding. Absolutely. Yes. But if this information that we're reading today is actually put out to people, particularly those with autism, or their caregivers, family or significant other, their partner, then they're going to be more in tuned and prepared. What I find is that there is an ignorance with lack of understanding and education. And that's why we do our channel. If we can share through lived experience what we've had to learn, if we can save you the time, the energy and reinventing the wheel and give you this information of things to be mindful of as you go through the different stages of life, then it should make your life better and well prepared to manage it and for those around you. Now, as the research says, for those in midlife, menopause is a challenging transition. For many autistic people,
I'm postmenopausal
they reported experiencing more severe physical and psychological menopause symptoms compared to non-autistic people. Yeah. We also uncovered evidence that found life expectancy may be lower in autistic adults compared to non-autistic people. Now, I have seen that through many studies. Now, part of that, I'm going to talk about that first, because part of that ties into the poor health aspects for some. For some, it's the inability to access healthcare, to advocate, to speak for themselves, and also the challenges of navigating a very complex health or disability system. But you then also have a higher precedence.
Speak English.
Get that dysphagia in,
They don't speak English. No, I don't understand. Guys, I don't understand a lot of people out there.
Have you had difficulties navigating the health system yourself? Yes. Did you abscond and run away from it rather than go towards and easily navigate it?
Because if a grown man's going to yell at me, I'm running.
Right, so it's intimidating.
I can't deal with
You've also got sensory overload in clinics and hospitals.
What woman
beeping,
do that?
bright lights, smells, air conditioning, touchy, feely.
Do you know why?
Yeah.
Because if I have a meltdown at a hospital, guys, I'm socially unacceptable. Even though they know I'm autistic. So I can't be in the world, in society, in 2025 as an autistic woman.
So I'm also not surprised that they've uncovered evidence that they found the life expectancy may be and is actually lower for autistics.
Right.
I'm not surprised at all. Now, particularly if it's not longitudinal studies, particularly in your case, I mean, basic cardiovascular is a major issue for aging autistics. It's the same for 22q11.2. The primary cause of mortality for your genetic condition is cardiovascular. No friggin' surprise at all. Okay, so there's a correlation. But the other part that doesn't surprise me is what I've seen anecdotally firsthand. It's the
Yeah.
mental health related issues and leading to suicidality for those with autism.
Yes.
Okay, the stresses,
You
the
gotta
implied
check
stress of being
all
neurodiverse,
young
living in a
ones for that.
neurotypical world, trying to navigate whether it's
Yeah.
family, relationships, workplaces. I mean,
And if they don't have the
72% of
toolbox,
autistics can't manage to sustain
No.
a job, full-time job.
They need like a toolbox of coping skills, and that takes a family.
Yep.
And I know that I heavily have relied on family, including like my own children had to be sometimes my guide when they got older. So I'm talking about adult children here. I'm not talking about children.
Yep.
I'm not talking about minors. I'm talking about
18 and above.
my children stayed at home a lot longer because that was an open house policy
and they
in
were
my house.
autistic ADHD. They
My
needed the
children
support longer.
Always got an open door policy we had for our children. So
Absolutely.
anyway, our kids left 24, 26, say, roughly around those ages. So at the end of the day, compared to me leaving at 18, I believe that the skills you need to give them before you let them go, or before you cheer them on when they say, I want to go, they need that toolbox.
Absolutely.
That keeps them safe, guys. I'm not kidding.
Now, you say that from one hand, for us having learned the experience of both being autistic and our own personal struggles of navigating at a time when it wasn't understood about autism, wasn't being picked up, wasn't being identified early, wasn't being diagnosed, and the supports were certainly not given early. We gave our children the supports from day one to make them be able to function, get through life, education, and a career path and relationships.
My autistic son the way I
we
was
learned
treated.
because we didn't have it for ourselves.
Yeah, I treated our son who's autistic different to how my mum treated me.
Now, my concern here is
different.
the researchers. I'm just reading this last sentence from King's College and from Gavin, who's written this journal article. It now reflects what I was just talking about. This, when we're talking about uncover the evidence that found life expectancy may be lower in autistic adults. This is often linked to conditions such as epilepsy, which is seizures, either non-epileptic seizures or seizures. I've actually got to point out, I think it's 2.4 times more likelihood of death having a non-epileptic seizure. So when you have an epileptic seizure, there are better protocols, procedures, understanding and medications in place. For those that are diagnosed non-epileptic, they are discounted more and said, it's not going to affect them. Those are the ones who actually have more life-threatening concern.
But guys,
that's another story again.
No, but it's the study. It's as simple as this. We don't have a high enough significant percentage study to detect epilepsy.
Correct.
40% only get detected.
And particularly when it comes to things like genetic epilepsy and genetic seizures.
It's not a good test, right? So we need to get that
40%
higher.
Money needs to go into research, and particularly for those 7,000.
Not enough money goes
250
into
new
so
rare diseases every year are being added to that 7,000. So we do need to keep that in mind, because look, they hope from that 5% that are being currently treated and managed out of the 7,000 conditions, they hope to increase that to 15% or 20%. I know it still seems low, but that's still huge inroads. I'd love to see it get up to 50% or 75% in the next, 15, 25 years.
Study of testing you,
testing
and getting you
and treatment.
You
just recently this week did a DNA sample which you've sent across to Adelaide and other universities, Melbourne University, to help specifically to look at medications in genetic epilepsy, the efficacy and improvements, how they can actually work.
The reason
participate in studies.
There's two ways you can get epilepsy. You're born with a syndrome like this because our deep brains didn't form properly, probably. So that's difficult, because if it's deep brain or if it's in a certain part of the brain that doesn't hit to actually read on an EEG, it's got to hit the skull. Yeah. That's not easy, okay? Doesn't mean that inside that skull shit's not going crazy.
No, exactly.
And also, when you've got genetic epilepsy, we don't respond the same. No. Now look, I do respond very well. I've gone from 6 to 10 seizures a day to maybe 1 a week.
Well, I'm so glad that we're not on the days where we used to have 18 seizures a day. That was pretty horrific. And look, there's multiple causes, and particularly 22q, whether it's febrile temperatures, and that's why I took the temperature at the very beginning, 37.5 and above. So febrile temperatures. Infections. Oh, look, we've got another infection in the body. We're dealing with antibiotics, probably going to a second antibiotic very shortly, and
my dog's
steroids.
on holiday.
So infections and antibiotics, electrolyte imbalances.
Tell my doctor that you do this.
He
like
does
you just
this
have
so
this
often.
psychic ability
Of going on
Go,
holiday.
I'm going on holiday because she's about to get sick.
And she ends up
I'm
getting
going to
sick.
stir him up.
He's allowed to have a holiday. I get
I
it.
know, but you know what? It's like, really? Really? Now I'm sick again and he's on holiday.
All right, finishing back on this article because I want to wrap this up. So, I am concerned about the issues with autistics and rates of suicidality. There's also other rates of other mortality and even incarceration.
Please reach out to
There's
people.
incarceration and mortality. You know, death by cop. We've heard a lot happening, particularly coming out of the States. This is why actions such as the national card for autistics, so that they can clearly identify themselves to law enforcement and other first responders, is important. Having things such as even in our car, you can have car straps. We've got stickers on the window, so if we were in an accident, first responders can see that Dyan may be totally non-responsive, not responding normal, acting in a different and weird way because she's autistic in a crisis in a medical emergency.
Situation, I can push people away, and they're like, "I'm trying to help you," and I'm like, I don't want to be touched.
Now, you've also got an AAC, an augmented alternative communication device. You're talking very well right now, but there's other situations, particularly high stress, where you go selectively mute or cannot communicate at all.
And it's not selective.
No.
I don't get to select. Oh, I'm not
Today I'm talking,
today.
and today I am talking. No, it doesn't work like that.
Like
Sometimes I wish she would select that she doesn't talk, but she doesn't do that for me or herself. I'm teasing. Okay.
I missed
she
it.
could talk underwater, this girl. But there are, and this is why we also have this is why we have a guardianship in place, because in certain situations, Dyan, as most people with 22q, need supports, whether it's dealing with legal, whether it's dealing with medical situations, to be able to help them navigate through those sort of situations. So many autistic people, so I'm coming back to the article, are also encountering barriers in accessing physical and mental health care and support.
That's not okay.
Often because the services lacked autism awareness. This further contributed to poorer health outcomes. Now, I'm going to talk to this before you do, because I know you rabbit on a little bit. No, I'm teasing. You don't rabbit on, but it's easy to go on tangents.
I do.
I have only sat with the hospital that Dyan is now at, with the executive. This is the chief executive officer, the clinical services officer, who's the executive director, as well as the director or manager of operations. I've sat with them only in this last month to work out ways for better accessibility for Dyan, because it's been clearly identified in the last 3 years that Dyan is failing in healthcare because of accessibility, because of autism. Going into environments that are literally sensory overloads. She has her sunglasses on. She has her ear defenders on. She has lanyards that say that she's autistic. She has a AAC device so she can communicate. But a lot of the time, they don't follow the advice given to them by the geneticists that say you need to slow things down, give twice as much time, allow for the executive dysfunction that occurs, the auditory processing disorder, communication issues such as aphasia, stuttering, slurring, word finding, memory, Tourette's that comes into it, or seizures, tangent and track with OCD, looping, and often to tangent ADHD.
And episodic memory problems.
So I sat with them, and they've now actually got an A4 page that actually explains Dyan's communication needs. That's throughout the hospital, at clinics, in the ED, inpatient. It helps them engage. Dyan's got a communication passport for the hospital, so when she's inpatient, nursing staff, new doctors, any staff can actually work out who Dyan is, what her interests are, how to engage, how to interact, how to communicate. And that helps improve. So I'm not surprised that it contributes to poorer health outcomes, because we've had to do huge amounts of work to actually allow for that. Please, I want to hear from you now.
Why? Because when I was a trained social welfare person, so before I did psychology,
you worked in welfare.
Another place I could have worked was Lifeline. And I'll tell you this, Lifeline people, learn about autism, for goodness sake. Seriously, like, you need to realize and identify, and there's simple things to look for to identify when someone calls without even them possibly even saying, I'm autistic. Okay, you can pick this up.
The traits.
If you actually gave a shit, you would pick it up. So please, if you know anyone that, even if it's a paramedic, an ambulance officer, we call them here.
First responders,
First responders, educate them yourself.
Now, that
yourself.
Training is only starting to roll out in some areas. Some have already started to do that.
The
Australian government this year is actually working on a plan to assist autistics nationwide, whether it's in the community, to access healthcare, to jobs, to education.
Oh yeah, that's a good thing.
That's a part. The national card, which is a photo identification card that says you're autistic, and here are the things that are issues for you.
But I wish I had these plans they have now for working.
God, I wish we had them back 10, 20, 30 years ago.
Yeah.
God, that would have been so much better.
Yeah.
But there's no surprise that 72% of autistics struggle in the workplace. I get that. But healthcare, and I have seen this both in mental health and in normal healthcare, the difficulties, first of all, overshadowing, misdiagnosis, not understanding that autism is not borderline personality disorder or bipolar. It's actually autism. So getting the right label helps to get the right appropriate treatments, obviously, and the communication.
Which one? There was these kids being diagnosed with bipolar and heavily drugged with psychiatric meds. Not a good thing for autistics, by the way.
Yep.
Be careful with psychiatric drugs.
You could have adverse reactions if you've got
certain
autism.
ones for meltdowns. I understand for sleep. I myself need it. But the fact is, I only use a certain type and that's it. The other types I don't touch, because I have to warn you, like, be very careful with medications, because you can induce something rather than it be organically there.
Psychosis, for example.
Be careful. And depression.
Yep, depression.
There's a lot of people that take an antidepressant, and apparently a lot of ADHDers are that we can be given depression by the tablet.
Absolutely.
Okay. Just speak to your doctor about it. Speak to a doctor that listens, because the opposite can happen.
Don't suddenly stop taking your medication.
No, speak to your doctor,
Teeter the range
but
down,
I've had
build up carefully.
Medicine.
Be mindful
that
of.
my doctor was like, why are you on this? I'm like, it's for anxiety. He's like, it's bad. And he explained to me, and I went, right, I'm not touching that stuff. And then when I went off it, it was like, oh, I feel like me again. I feel good again. Just be careful. Some psychiatrists with autism are too... I mean, psychiatrists in general are too medication-based. Okay,
script-based.
It's dangerous. Some psych meds are dangerous, and we have to be honest about that. Like, as consumers, guys, you've got to understand the reality. Talk to your doctor, though. Your doctor should be listening to you.
Should is the first word. Find a good primary care physician to work with you. That's super important. You're very lucky that you've actually got a doctor who is autistic, ADHD, OCD. We're the trifecta. We're in the same cool club.
Health. So he looks at like food, between food to vitamins and minerals, as well as medication. So he's okay, but you can find a doctor like that too.
There's still a lot of unsubstantiated studies with things like food colouring, diet that works well for autistics. Do your study, have a look at that. We've seen the benefits.
And took her off like
certain types of diets help. Seizures, absolutely. Sugar.
I know myself, if I have too much sugar or caffeine, I can be a little bit annoying. Yeah.
There's also separate research which also clearly understand that things like CBT, cognitive behavioural therapy, is not always conducive for autistics. It needs to be tailored to understand the autistic's communication needs. It may not actually be able to tap into it. DBT and dialectic behavioural therapy can actually be seen as a better format, but doesn't also always work. Talk therapy.
Like,
is difficult. So we use talk therapy in the way of social stories, emotional cards for emotional regulation is important as well.
Emotions cards I recommend, guys, because most of you don't even realise that, males as well, you don't realise that probably that you do have alexithymia. The emotions cards,
all those things as well.
like Tony Atwood says, you know, mad, sad, happy,
limited.
and glad.
It's a limited vocabulary of emotions.
That's limited. 4 things. So you got to expand on that.
And this girl has got a lot of emotions.
No, but what comes out of it, doesn't it? When I pull 3 cards, and I normally say 3, that's 4. 3.
There goes the dyslexia again.
3, no.
Get your fingers right.
3 is like a good one to social story.
Yes,
and we finally get to the point at the end, don't we? Within 10, 15 minutes, and I go, oh, now I know what I'm feeling. Okay, now I can resolve it.
Bingo!
It's that simple,
and it does
guys.
actually work.
So if
get
you
to know
actually
your person.
feel like you're anxious and you're pacing, okay, and you're like, what's going on? Just pick up the emotions cards.
And not everything that we talk about or may work for you specifically. Because like I said, each autistic person is different. Just as much as a weighted blanket is great for some, and other people go, oh, it's the worst thing since sliced bread.
I love
other
them.
people enjoy fidget or sensory type toys. Others think, what is that? So there are different things that are available to you. Now, I'm getting to like that. Gavin here has written some very interesting things from King's College in London. I'm liking what I'm hearing so far because it actually does reflect all of the research that we've been talking about for years. And it's actually good to see someone in the media, as a media article, bringing it together to highlight this, because we need to have this conversation. Hence why it's on the channel called theconversation.com. I actually think, apart from the humour part of it, it's actually very important to be able to talk about these things, because we need to be prepared for it. But I am actually concerned. I'm concerned about seeing you try and navigate the health system. I'm concerned about others that I've seen who are autistic or ADHD trying to navigate the health system. I'm concerned for myself. I mean, I've learned a lot along the way, but I don't go willingly towards healthcare.
No, you don't.
Myself, but I should, and I should do better. So there are challenges in that, but it's not a surprise to me that accessing physical and mental health care support has actually led to some of the outcomes that we've talked about, which is fatalities in that space for that cohort of people. Now, there's also a mixed picture. There's a mixed picture for cognitive health. I'm going to keep reading this. The evidence was rather mixed when it came to cognitive abilities in midlife and old age. Some autistic adults maintain strong cognitive skills later in life. Brilliant. Others, unfortunately, struggle with memory and executive functioning. That's the thinking and planning, which are important cognitive skills in day-to-day living. I actually do think,
be my seizures.
and I think, look, I'm going to actually pull that into it. I think as we've seen a few things. First of all, we've seen that plateau and exponential growth, where for a lot of autistics, you peak and you might actually decline, while the normal population keeps going on their linear, sometimes exponential growth of development, and you can get locked into a certain age group mentality or performative behaviour. Okay, so that's something that happens. I've seen too, particularly with you, because you've got a genetic condition that's predisposing you towards autism, it has issues that affect things such as memory for retention and recall. It has affected your communication, such as aphasia or speaking. Throw in there if you've got mixed conditions such as Tourette. Doesn't make it easier at all.
Teenage years.
Yeah, but the other part I've seen,
hormones probably.
When you went to the neuropsychologist, you were also called prodromo to early onset dementia. Now, understanding now...
That's how bad my memory is.
Yeah, but understanding now so much more about your genetic condition, it's the prodromo, not so much sort of a dementia, but declines in cognitive capability across all the domains is what I'm expecting based on the research. But there are some, could be still you, and certainly could be other cohorts of participants who might lead into Alzheimer's or dementia. There is a high precedence rate from what I've seen with the research with those with autism to get those conditions. So let's be mindful of that. And that means, when I'm saying be mindful, we have to be aware. You were very good at picking up when my dad obviously started to get the early onset Alzheimer's.
I went to the doctor with him.
Who was ignorant, the doctor.
Yeah, he's like, no, he's fine. I said, no, I've worked at a
dementia 2-3 car crashes later. He shouldn't have been driving. His license should have been pulled.
And I told the doctor he shouldn't be driving. I'm concerned of dementia symptoms. Bingo. And the doctor looked at me going,
ataxia, balance,
you're
coordination.
Just some idiot. I'm like, no, I'm not actually. I've worked in dementia unit and I listened to the big nurse.
And who was right at the end of the day? You were, and it should have been noted in this. And by noting those early indicators, you can have more compassion, more support, more understanding, but more protective behaviours. You don't want your person with dementia suddenly wandering off or doing something which is danger.
It's dangerous.
Hot water or whatever it might be.
Set their house on fire. But also, my grandfather, who I know was autistic, got dementia, Alzheimer's, didn't he?
Yes.
And I mean, I even taught my kids how to treat people with dementia and Alzheimer's. And our youngest son, I remember my grandfather was remembering a bicycle accident that he had.
Yeah.
And my nana was trying to explain it to my son and I, like, oh, he's remembering when he had the accident and had all the glass in his arm.
Shards.
And anyway, I said, oh, Jordan, just pick the glass out and help him.
Yeah.
You just got to go with it. And like, it was really sad.
Because you've actually worked in a dementia environment unit.
Moderate to high.
Yeah.
needs.
So you've done some
units.
early disability support worker
Yes.
training in that space. So you've got some learnt experience.
Yes.
Now, the research keeps going with this article. While many autistic people will cognitively age in a similar way to non-autistic people, there is, however, evidence that autistic adults may face a higher risk of cognitive decline and dementia, what we're just talking about.
Yeah.
However, more large-scale research is needed to better understand that. You're damn right, more research is it?
Yeah,
Because we don't have longitudinal studies for this cohort of people.
For autism research as well.
So what's the importance of social support for the more elderly aspects of autism as we're aging?
Well, they need to be included.
So let's find out. Studies consistently found that autistic adults report lower quality of life compared to non-autistic peers. Mental health difficulties play a significant role in lower quality of life. A key factor here appears to be the social support. Our review found that autistic adults who had strong social networks reported higher quality of life, while loneliness and isolation were linked to poorer well-being. This could be because many autistic adults report having fewer social connections and experiencing greater isolation, particularly men. And I will agree with that. The last part here, and we'll talk about this, we also found that factors such as receiving their autism diagnosis, learning to manage their capacity for social interactions, and being in social situations and maintaining autonomy play important roles in positively shaping quality of life as autistic people get older. So let's talk about those factors for the moment. I actually have seen, and look, I'm like that myself, and I think anecdotally, the older autistics go, they feel more comfortable with themselves, not having to deal with the outside world.
Well, I've always been like
become
that.
more isolated, more independent. Whoa! And that was the cat. My reactions were good, but I didn't catch him in time.
Oh, Max.
Hi, Max.
Okay, Baba. No, Baba.
He's fine. And there's Max. He was there. He's now there.
Baba.
It's okay.
Baba, you okay?
We had a Max slippage.
Maxie.
And Stretch. Good boy. Stretch. He's walking it off. Just walk it off, son.
So for me, I was always criticised as a kid for not engaging with other kids enough, because it was very obvious to not so much my mother, but every other family member, that I was not as much playing with the people in the street, which is my generation. I wasn't as social as my peers. And it was obvious to like one of my nanas and some of my aunties and uncles, and my reliance on TV, because that was my education on how to socialize.
I see two takeaways.
The narration in the TV.
That's how females learn social things, what to wear, how to interact, what to say.
But I could not manage sensory-wise being around the other kids as much.
Large group
so I'd be sitting with the adults like this, and just listening, because I didn't have to speak, because adults and children in my generation don't speak.
Not seen, not
heard. Really,
exactly right.
But at the same time, I'm like, you guys are talking about good stuff. They're idiots.
Yeah, so you want to listen to the high intellectual information.
Idiots. They're boring. I'm done with them.
And you were told to shoo away a lot of the time, but you say,
go play with the children.
Don't want
I was
to.
like,
and
I'd normally go and do something alone.
How did you deal with things like large events, like birthday parties and big events, which are noise,
so I was
balloons?
On the outskirts. So I had a big family, and it's very difficult to hide because there wasn't many children, because I'm the second born of the whole family. So you've got my brother, me, and then it's like my first cousin would be Zachary, and then
we're going into the whole family tree.
Lots of cousins come along.
Tangent.
No, not my first cousin. My first cousin was Dylan. But anyway, I had cousins come along, and so they became like I actually was very much a typical little girl in the sense of baby. Oh, I must nurture the baby.
Right.
Anyway, so I was fascinated with babies.
And that's the other part I'll point out, is you tend to also go to children who are 2, 3, 4, 5 years younger than you,
kids younger
because
than me,
that was more at your academic or intellectual levels at that age group, to be able to feel that you're not having to.
I always used to socialise with younger people.
So there's those
and I used to spend a lot of time alone, and people used to find that strange. Even my friends in teenage years would be like, "Come on, we're going to HJ's, down at Whitford's," and I'm like,
Exactly.
That's sounds really noisy and gross.
It sounds really noisy and
disgusting
gross.
and sticky,
Okay, right.
and
Icky,
there's
sticky
pickles
noise.
in the burger. No.
Right, pickles in the burger.
I'll
But
just
as
stay
a
home and watch
teenager
Star Trek.
and as a young
Thanks.
adult, you had lots of friends, lots of socialisation, lots of people.
I had lots of friends.
But today,
But did I want to play? No.
Today, at 51 years of age,
I have a friend.
Our friend down the hallway, okay?
Yeah. And then I've got these friends, but that's about it. No, but
Our friends online.
No, but I consider
In person.
No, this is the sad thing of my life, and this is the sad thing of autistics. And I do want people to listen to this because I'm not the only one. But I will share my experience because I know that I'm not alone as an autistic in this. My family was my best friends.
Yep.
Same with my own sons.
Yep.
As they got, not when they were children. I did not parentify my children.
No.
As soon as they were 18, it was
Parented
like,
your children.
okay, so now I can stir them up and say, you did this when you were 3. It was so funny. To the girlfriends or whatever. Yes, I used to
Banter and tease, yeah.
banter and tease, but then I'd become kind of like, yes, when push came to shove, I was their parent. It was our house. So it was a difficult scenario. But your
Defining
adult children
boundaries.
these days live at home. And it didn't bother me. I'm not going to hurry them out. When they want to go, they want to go. But basically, when they left me, and they didn't just leave me like the normal way, they kind of left in an extreme way. And maybe that's their own burnout of their own neurodivergence. And also that they've had such a bond with me and with us that they need to experiment now and go and have bonds with others. And that's a good thing. They've got their partners. Their partners need to be their confidant and their, they need to make decisions now together of their future. I don't have a say on their life anymore. I'm just there to, I don't know, listen and share.
But you come from
I've lost my friends.
You come
So
from
my
an
kids
environment
are my friends as well.
of the inner circle of trust.
Yeah.
And when that dissolves, or when you become orphaned, and that's effectively what you are now, because you don't have family or supports or anyone in our life.
My kids chose my abusive parents, unfortunately, guys.
And that's another story, and that's another video.
I actually thought this is connected to autism. I feel that the reason it worked toxically, that I lost my children's respect, because they think that those grandparents deserved it.
Yep.
But they didn't earn it from day one. And grandparenting is not just about the title because of birth. Okay, you've got to perform to a certain level to be that.
Yep. Absolutely.
Agree?
Absolutely.
And they didn't earn that. They didn't want to know. My mother didn't want to help me with my children.
So you can see from your journey then,
who's not her daughter, she would do the washing for. Okay, it's toxic.
Exactly.
Right? I was never assisted. And then, which means my children suffered too. Not just me, my children. But now, I believe the bullying is because I'm autistic.
So this snapshot is useful and is relative to the conversation that we're having.
I'm autistic.
Because you've just experienced, I guess, how Dyan went through from early childhood and the lifestyle,
I don't have the
hanging out
skills.
with the adults, told to shoo away, couldn't cope with her same peers, so having to deal with children 5 years younger. Then the formation of our own sub-family as we have our own children, and how that inner circle dissolves because it's no longer here.
And even their partners, I looked
and
at
their
their
progression
partners with absolute like friendship, respect, connection, and it's like I lost all of that. So I've lost my friends.
Strong social networks are paramount for our own personal development and mental health. A feeling of belonging.
Autistic.
If we don't feel that we belong, then what's the point? And then that has a direct contribution to why there's a higher level of self-harm that occurs in this cohort of participants, which I understand. A lot of autistics struggle just to fit in, whether it's in the workplace, in education, in their peer groups. They might then dress differently and awkwardly. They might not know the social cues, and what they're saying might be going over the head. You literally don't understand certain types of humor, and it just slides on by because you're not getting it. Okay, that makes things difficult. So if that's continuing into later adulthood, I can see why people then pull back and go, bah humbug, it's a little bit difficult.
No, but it does affect you because I feel like because
linked to poorer
the way
well-being.
Things have been set up now with my family stealing my children when they didn't want to know them before, and now they all want to know them now. It's all just power games, guys. Like just picture it as just one big power struggle. But what's happened to me, the autistic, the vulnerable one, is I can't socially navigate through it. I can't, you know how they say, oh, well, it's a game you've got to play too.
Game
I
of
can't
life, right?
play games.
No.
So I lose. Nothing I say or do will ever be right. It'll never be good enough. And unfortunately, my parents, I believe this is how they're keeping me alienated, is basically my autism. Is weaponizing my autism against me.
Sure.
I've seen them do it to a cousin of mine, and I got very angry.
Yeah, so
I got very angry, and I said to my mother, "No, you're dead wrong.
We've seen it happen in the family structure.
Do not do that."
It's become very fragmented.
And then she's like, "Oh, my brother's so mad." It's like, "No shit, Sherlock. Why wouldn't he be? You don't understand.
So,
this is real."
What are then the important considerations of all of these conversations and the research? Now, I'm going to read through this, but we're getting a better of a picture here, and I do have concerns for the aging population of autistic. We were talking just recently about a beautiful UK singer, Susan Boyle. She was on one of those singing shows, like The Voice or whatever else. I don't know which one it was. Exactly. My apologies. But she had a beautiful singing voice. And you're also reminding me, again, as she was aging, and her difficulties,
it was sad.
Because she was finding it difficult because it was overwhelming. It was overwhelming.
The fame
dealing with fans and
meltdowns.
people coming towards her, wanting her autograph, wanting her to participate in different events and representing things.
Of doing a CD,
and she became very isolated and very quiet.
She
and
went back
pulled away from it all.
She said no thanks and went back to
normal
life.
And closed the door and and I can see a lot of autistics that actually do that. You get it? Okay.
Yeah, like my purpose here with what I like to do is to get good messages around the world. I really feel sorry for people like that. Like, she really got, you know how people are with people that make it big. And Australia's the worst place for that.
Yeah, we have tall poppy syndrome in Australia. No, this was Australia, and Susan Boyle's from the UK.
Okay.
But I'm going to actually do a link back to an Australian autistic who you also may be aware of, Chloe Hayden. She's in Heartbreak High, seasons 1 and 2. I think they're talking about a third season coming out. I might be filming that. Again, she's grassroots, female autistic.
Yes.
She's written a book out there that's not different from Memory. Is the book. She's been on YouTube, but she's also pulled off and hasn't actually done any YouTube content or any other social media content for a long time. But she also found it was too hard to navigate and negotiate her way through the social media ins and out, responding to comments, responding to bullying, and there's an intense amount of bullying to those who are on the spectrum. And when your everyday actions of life are then being called out or saying that you're faking or it to garner more attention.
I know.
Again, I can understand why she's pulled herself back in.
No, but she was stimming, and I tell you what,
that's right. She was stimming, watching the whales. I was going to tell you, there's some whales in Perth at the moment going through right now today. Don't look at me like that.
Late.
They're still swimming.
No, we could have.
Just off the coast.
Anyway, we'll talk about that later.
Sorry. Anyway, ouch! Would you stop doing that? Anyway, I've got to get back to my important considerations. Yes.
It's really sad because she was literally just showing
enthusiasm, the sheer joy of seeing a pod of whales.
It wasn't fake, and it kind of annoys me that
stimming, right?
She was just brave enough to show that moment, which I know sometimes I've done the same thing. I've looked at my videos and gone, sir, like, I don't think I'm going to show that because, I look really autistic. And he's like, that's kind of ironic, isn't it? Like, what are you doing?
Kind of the point.
I'm like,
but at the same time, there are times when we have to protect Dyan because
of assholes.
Sorry.
You guys know about
that's what happens.
Of life.
Now, I'm just conscious of the time, so I'm going to wrap this up with the important considerations, some of the summative findings from this article. Because it's been a good article and it's stemmed a lot of a lot of conversation. When thinking about the findings of this review, it's important to recognise the limitations in the current research. Only a small fraction of autism research has actually investigated aging and an autism. From what's been published, the published literature has been done of this topic has actually focused on those diagnosed in adulthood, so not the whole lifespan. This overlooks a lot of autistic people who are diagnosed with autism in childhood and those with intellectual disabilities, IDD, or higher support needs. They're often excluded from research. If you're non-verbal, it may be a level 3 autistic, you might not be able to participate answer and respond to the questionnaires and be part of those sort of surveys, and your caregivers and parents may not be aware of it or may not be able to answer for you in that role.
Can't answer for
so
everything.
Underdiagnosis of autism is another major issue. Now, although autism affects about 1% of the global population, health records in the UK show very low diagnosis rates among middle-aged and older adults. They're clearly autistic.
Yeah.
But do they want to go through the process of having to find a psychiatrist and go to a psychologist and answer all the questions?
We know what our special interests are and we just want to live there.
Exactly, which is why they maybe close the door, pull themselves in and just do what they're happy and comfortable do, pottering around in the garden or singing the songs at home.
That's what I've done. I've just sort of pulled away because, not really because it's my choice. I know that one of my sons said that. He said, "You've self-isolated." And I said, no, I've been rejected. Look at what you've done to me. So, and then the others have done the same thing. Bingo. So at the end of the day, guys, don't take the blame if you're excluded. Please know the difference of whether you are the problem or someone, it's a bit like the question, am I the asshole? Yeah. Or are they the asshole?
Which is why the Australian government this year only for the first time are doing research and bringing together a guideline for supporting autistics across Australia. Like I said, whether it's in healthcare, the community, educational workplaces, that's important. And that's going to involve engaging with autistics and autistic support groups.
Because the one thing I've noticed is no one meets me where I'm at. So at the end of the day, don't ever...
Bingo.
I will never tolerate anyone accusing me of withdrawing because it's like, I am an ADHD, actually the hyper version. I really love to socialise. I'm the life of the party when I'm at a place where I fit in, where I know it's for me, where my ethics do align as well, where I know I want to be, because I'm at that age where I don't go places I don't want to be, because I'd rather be alone than somewhere toxic. End of story. I think I decided that at about 25.
We joked with your condition 22Q.
People don't meet me where I'm at. Is that my fault? No, it's not.
We joked about your condition 22Q because there's no adult specialist for Dyan across all of Australia. There's two for children though, at Perth Children's Hospital and one in Queensland.
In my state.
Now, the reason why I say that, most of the children hospitals these days now have sensory rooms for autistics entering into those environments. They are actually aware of the disability and the need for sensory regulation, and how those environments exacerbate people who are already feeling pain and sick going into that space. Hence why the conversation with the adult hospital only just recently. So anyway, estimates also suggest that around 89% of autistic people aged between 40 and 59, and 97% of those aged 60 or over may be underdiagnosed.
Absolutely.
This is in part due to autism historically being viewed as a condition that only affected children. Additionally, gender and gender bias in autism diagnosis are common, resulting in women's and girls being historically overlooked.
I was told So in my era, it was you're developmentally delayed. You're intellectually delayed. They never called it autism. And they called it hyperactivity though, like the boys were given hyperactivity. So in my era, we weren't called ADHD or even ADD. No. It was called hyperactivity or inattentive. Yeah. And of course, remember under ADHD, there's two. There's ADD and ADHD, and they're very different.
So in the future, we need more studies, more research that track autistic people and their experiences throughout their life. I'm going to say the same thing for 22Q. We need the longitudinal studies. Including as they get older. We also need to make sure research is representative of autistic people more broadly. For example, by including people with higher support needs and those diagnosed earlier in life. Finally, autistic adults themselves must be involved in steering the direction of research and the creation of resources and policies. With their input, we can support healthier, more fulfilling and socially connected lives so that they're able to age well with dignity and autonomy. I think it's very important having both that dignity and autonomy.
Absolutely.
While aging in autistic people has been historically overlooked, we're making a lot of progress in addressing this major gap in research. While the current evidence included in our review has identified a lot of challenges that middle-aged and older autistic people might face, it's also highlighted opportunities for where autistic people can be better supported as they get older, such as improving access to healthcare, helping people remain socially engaged. With a better understanding of autism in midlife and later life, we can begin to reduce the health risks for autistic adults that they face as they age and improve their well-being. So that's from The Conversation, Gavin Stewart, King's College London, September 2nd, 2025.
You know why I believe aging is the reason for the social isolation too, guys, is I believe it's because that's the age when our families just go, oh, I'm done with you. There's not enough tolerance in families anymore. Families are wanting perfection, families are wanting the money, families are wanting things that, unfortunately, I'm not saying every family, this is talking about my experience and maybe some of your experience, and if some of you don't understand this experience, thank goodness. But there are a lot of families like mine who they don't want to include you because of your autism. That's me. That's me. The reason I said to you the other day, didn't I? I said the reason I'm excluded, when you really come down to it with my whole family, all the time it's been my 22q, which involves my autism, ADHD, everything, my physical sicknesses. None of my family, the main people that were meant to care for me, it was always, oh, it's too hard. It's too hard. So, and then my kids walked away too, being, it's too hard. Well, I can't change. No, they have to accept who their mother is.
Now, in your situation as well, having a genetic chromosomal disorder 22q, we see with rare conditions that they do take anywhere between 10 to 15 years to get a diagnosis. Now, you can imagine if a lot of these elderly and aging autistics aren't actually presenting to healthcare, are having more and more struggles, they're not going to get diagnosis at that point in time in their life. 7,000 rare conditions, a lot of people don't get diagnosed, so that's the problem. Speaking of which, then you also don't, but they also don't then loop into the supports, whether it's in ACAT, which is the aged care team, or the NDIS, the National Disability Insurance Scheme. There's another article which I'm not going to read now, or we can probably at any point in time, but just mention it briefly in conjunction with this. And this is on news.com. It's an article about an autistic mum who can't cook and who's been rejected by the NDS. So she is obviously more of a maturing female. She's got children who are autistic, who are on the spectrum. We now know that in Australia, with the failings of the NDIS, and particularly the blowout financially, that most of those children with autism are being kicked off the NDIS scheme, and it's going to be maintained by the states and through education systems.
For a lot of autistic mums, I had to do it alone, guys. I know if you're doing it alone and you've lost funding, I feel you.
Now this particular mum,
and it was really hard.
Struggles because of her executive functioning, her intellectual capabilities, her sensory overload with food, and she struggles with the whole cooking and cleaning process. Now, she's applied for the NDS, they've rejected her, she's escalated that to the AAT, or as it's now known as the ART, Administration Tribunal, and she's been rejected because she's successful in other parts of her life. That means because she's masked very well and has hyper focus and can achieve very well in these areas, she can't transfer that capabilities into areas that she's failing. And how does an autistic mum who can't cook or clean manage to look after her children who need nutritious food? So they then say, well, she's got a husband, the husband can do all of that.
She probably didn't know
isn't her husband also at work full time? How does he do all those aspects while at work full time?
And you know what?
The system is ludicrous.
The sad thing is she probably got diagnosed after she had
kids.
Yes,
she actually did. She got the late diagnosis because her children got diagnosed first.
Yeah, our son got diagnosed at 3.5.
Her children will probably get off the NDIS and go into the education support system. They won't get the NDIS supports in the home. She can't get the NDIS supports. It's reliant upon the other informal caregiver, the husband, who's meant to have a full-time job to bring money in.
We've been there.
Been there, done that, brought the shirt. These are some of the problems that autistics face in real life in the Australian environment. So we know that there's gaps. There's no perfect solution. We need to keep having this conversation.
The fact that sometimes you don't choose to be isolated. Like when we were raising our family, I didn't choose to be isolated. Sometimes grown adults can bully grown adults.
Absolutely.
And that's what happened to me. I got bullied because people perceive me as, no, you can do better than that. And it's like, like I'm being myself and this is me and I've been bullied and I've had to set boundaries and go fuck off basically and set a boundary because it's like seriously, but people don't think that an IDD adult deserves the same respect as the child with IDD and I don't get it personally but my whole family pick on me because of IDD, and I think it's disgusting.
Mm-hmm.
But it's just that's what happens.
But also your language style, your learning style.
Where's her mum?
Where's her mum?
Supporting. Huh? Yeah. Exactly.
I get
and
that.
I'll tell you this right now: my friends and your sisters had a mum.
Yeah,
to help them through their career. So
yeah, which we didn't have. I get that.
Fuck off to all the people that judge me for not managing things as an autistic with 2 children when not one parent of mine supported me.
No. So
through having children.
Sparked.
So it depends on your supports.
Yeah, it sparked a
Informal
conversation.
Support, sorry, is
this
what I
is
mean.
from
She's got
the
no
conversation,
yes.
the media outlet. Love to hear what you have to think about some of the things that we've talked about in the comments below. So I'd love to hear your questions, ideas, or suggestions as usual.
It's a big one.
Don't forget to give us a big thumbs up and a like for this video because we're having the conversation now. We're sharing our own vulnerabilities and our own experience, and please be sensitive to that in the comments as well. If you're new to the channel, please subscribe and hit the notification bell. Share our channel far and wide so that other people who are maybe neurodiverse, whether they're autistic or ADHD or somewhere in between, can actually find this conversation and be part of it as well. I think we always live in the moment, in the now, okay? And we're trying to just struggle and deal with NDIS systems and health systems and function in day-to-day life. And that takes away from us actually having our life and obviously...
It's not that we don't try.
Having the best quality. And that's
still waiting for the
quality
phone call.
of life. Oh yeah, we're still waiting for the phone call from Monday,
so she's obviously
9 o'clock.
sick today as well. So we'll see tomorrow. See what I mean? Tomorrow's Wednesday and I still can't say to Sir, well, if I'm feeling okay with this infection, we can go and do something fun. I still can't do that. No. You know why? Because it's a very important call we have to wait for. So, but
we're not going to be waiting for it because you know what?
I know, and we won't.
They can
but
email,
I'm just saying,
and they can schedule a day and a time.
Yeah,
and they
agree.
Can stick to that because I'm not on call
That's
in the middle of trying to shower you or medicate you or support you through a seizure or whatever else. We actually get to have a life, not these people controlling and dictating our life.
Normally we don't do that, is what I'm saying.
I'm so over that system.
And normally we don't do that.
Yeah.
So that's what I'm saying. Like, guys, it's so hard to have a life on the system.
So
hard.
I have 2 concerns. One is for my view of 22q, your genetic condition, that micro deletion of the 22nd chromosome. You're missing 30 to 50 genes, 3 million DNA building blocks, and that can obviously permeate in anywhere up to 185 clinical symptoms. There's no longitudinal studies. Okay, there is an early mortality rate. With autism, there is an expected early mortality rate. Multiple research says this as well. So we are both concerned when you see those things. Things need to be different. Things can be different.
Maybe
things should be different.
Doctors need to learn
there should be accommodations. Just as much as me going to a hospital and saying, you've heard of disability, now let's actually make accommodations for disability to access.
Do GPs know? Do hospitals know that autistic
or crisis care, as you said, the helpline. You said the same thing.
They need to know what's autism.
Yeah.
And so do GPs and nurses and doctors at the hospital. They need to know, like, oh, you're autistic. Okay, you got higher chance of cardiovascular, blah, 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 blah.
Most GPs won't even understand things such as the comorbidities that go with whether it's hypermobility, GI tract related issues, just
all of us
eating
know,
disorders.
But they don't know.
They don't understand. They're not prepared for that. Well, guys, thank you very much for joining us in today's episode. Appreciate it for you to spend your time with this conversation. Love to hear what you think as well. Max is here. Max is our autistic cat. Dogs are ADHD and cats are autistic, aren't you?
He's amazing.
He is amazing.
This one's retired now.
Hey, buddy, you're there. All right, we'll see you in another episode. Bye for now.